Let's address a question that could transform your confidence and vitality. What if a few simple exercises, done in the comfort of your home, could improve your blood circulation, strengthen your erections, and help you feel alive again after 60? I'm Dr. James Carter, a men's health specialist with over 30 years of experience helping senior retirees, grandfathers, and everyday men reclaim their sexual health and overall well-being. I've worked with thousands of men who thought erectile dysfunction, ED, was just part of aging, only to discover that targeted exercises can make a profound difference. Poor blood flow, often caused by stiffer arteries and reduced nitric oxide as we age, is a leading cause of ED. The right exercises can counteract this, enhancing circulation, boosting pelvic strength, and improving performance naturally. In this video, I'll reveal 4 powerful exercises tailored for men over 60 to improve blood circulation and enhance erectile function. I'll explain why they work, share a senior-friendly routine, and highlight 3 common mistakes to avoid. If you're ready to take charge of your health and intimacy, subscribe and hit the bell for more senior-focused wellness tips. Type 1 in the comments if this resonates. Type 0 if it doesn't, so I can better support you. Let's dive into why these exercises are a game changer for men over 60. Why exercise boosts erections in men. Over 60, erectile function depends on robust blood flow to the penis, which declines with age due to stiffer blood vessels, reduced nitric oxide production, and conditions like hypertension or diabetes. Exercise improves cardiovascular health, enhances nitric oxide levels, and strengthens pelvic muscles, all critical for strong, reliable erections. A 2018 study in the Journal of Sexual Medicine found that men over 60 who exercised regularly had a 30% lower risk of ED compared to sedentary peers, with benefits comparable to some medications. Exercise also reduces stress, boosts testosterone, and improves insulin sensitivity, countering ED risk factors. I've seen patients transform their lives with movement, like a 67-year-old retiree, Tom, who struggled with weak erections but regained confidence after 3 months of targeted exercises. These exercises aren't about becoming a gym rat, they're practical, low impact, and designed for seniors to enhance circulation and sexual health. Let's explore the 4 best exercises for men over 60 to boost blood flow and erectile function. Exercise 1. Kegel exercises, pelvic floor powerhouse. Kegel exercises strengthen the pelvic floor muscles, specifically the pubococcygeus (PC) muscles, which support erections, ejaculation control, and urinary continence. A stronger pelvic floor improves blood flow to the penis and enhances stamina. To perform Kegels, identify your PC muscles by stopping urine mid-flow. Do this once for practice, not regularly. Sit comfortably, contract these muscles for 5 seconds, imagining lifting them upward, then relax for 5 seconds. Do 10 reps, 3 times daily. A 65-year-old patient, Mike, felt disconnected from his partner due to ED. After 2 months of Kegels, he reported firmer erections and better control, saying, "I feel like I'm back in charge." Studies show Kegels improve erectile function in 40% of men with ED. Avoid clenching abs or buttocks, focus on precision. Seniors with mobility issues can do Kegels lying down. Progress to 10-second holds as strength builds, but don't overdo it to prevent muscle fatigue. Exercise 2. Brisk walking, circulation booster. Brisk walking is a low-impact, senior-friendly exercise that enhances cardiovascular health and penile blood flow. It lowers blood pressure, reduces arterial plaque, and boosts nitric oxide, all vital for erections. Aim for 20-30 minutes daily, walking at a pace where you can talk but feel slightly breathless. A 70-year-old patient, John, struggled with ED and low energy. After adding daily brisk walks in his neighborhood, paired with a healthy diet, he noticed stronger erections and more stamina within 6 weeks. A 2015 study in the American Journal of Cardiology found that 30 minutes of daily walking reduced ED risk by 41% in older men. Use supportive shoes to protect joints and walk on flat surfaces like parks or tracks to avoid falls. If mobility is limited, start with 10-minute walks and increase gradually. Pair walking with deep breathing to reduce stress, a known ED trigger. Exercise 3. Seated leg lifts, pelvic circulation enhancer. Seated leg lifts strengthen the lower abs and pelvic muscles, improving blood flow to the pelvic region and supporting erectile function. Sit in a sturdy chair with your back straight and feet flat. Lift one leg, keeping it straight until it's parallel to the floor. Hold for 3 seconds, then lower slowly. Do 10 reps per leg, 2 sets daily. A 68-year-old patient, George, had weak erections and mild incontinence. After 3 months of seated leg lifts and Kegels, he reported firmer erections and fewer bathroom trips, saying, "I feel stronger all over." This exercise is ideal for seniors with joint issues, as it's low impact and chair-based. Keep movements controlled to avoid strain, and breathe naturally. Exhale on the lift, inhale on the lower. If balance is a concern, hold the chair's sides for stability. Progress to 15 reps as strength improves. Exercise 4. Gentle yoga, cat-cow pose, flexibility and blood flow. Gentle yoga, like the cat-cow pose, improves pelvic flexibility, reduces tension, and enhances blood circulation, benefiting erectile function. On all fours, align wrists under shoulders and knees under hips. Inhale, arch your back, cow, lifting your head and tailbone. Exhale, round your back, cat, tucking your chin and pelvis. Flow between poses for 8-10 breaths, once daily. A 72-year-old patient, Frank, felt stiff and struggled with ED. After adding cat-cow yoga to his morning routine, he noticed better pelvic mobility and stronger erections within 2 months. A 2019 study in andrology linked yoga to improved ED symptoms by reducing stress and boosting circulation. Seniors with arthritis can modify by using a chair or bed for support. Move slowly to avoid dizziness and stop if you feel pain. Pair with deep breathing to maximize relaxation and blood flow. 3 common mistakes seniors make with exercise for ED. These exercises are effective, but mistakes can reduce benefits or cause injury, especially for seniors. Here are 3 pitfalls to avoid. Mistake 1. Overexertion or inconsistency. Eager for results, some men push too hard, causing muscle fatigue or joint strain, while others skip sessions and lose progress. Overexertion risks injury, particularly for seniors with weaker muscles or heart conditions. Start with moderate reps, for example, 10 Kegels, 20-minute walks, and increase gradually. Consistency is key. Daily practice yields results in 4-12 weeks. Mike, the 65-year-old patient, overdid Kegels and felt sore until he scaled back to 10 reps, seeing gains after 6 weeks. Use a calendar or app to track sessions and stay accountable. Mistake 2. Poor form or technique. Incorrect form reduces effectiveness and risks strain. For Kegels, clenching abs or buttocks instead of the pelvic floor wastes effort. In leg lifts or yoga, jerky movements strain joints. Focus on precision. Isolate PC muscles, move slowly in leg lifts, and sync breath with yoga. John, the 70-year-old patient, improved his walking posture after coaching, enhancing results. Practice in front of a mirror or with a physical therapist if needed, especially for seniors with mobility issues. Mistake 3. Ignoring underlying health issues. Exercise helps ED, but untreated conditions like diabetes, hypertension, or low testosterone can limit results. Some seniors assume exercise alone will fix ED, delaying medical care. George ignored his incontinence until a urologist diagnosed mild BPH, which improved with medication and exercise. Consult your doctor before starting, especially if you have heart disease, recent surgery, or ED symptoms persisting over 3 months. Blood tests for testosterone or vascular health can guide your plan. Avoiding these mistakes ensures exercises are safe and effective. Let's create a senior-friendly routine to tie it all together. 10-minute daily exercise routine for seniors to boost erections. This low-impact, 10-minute routine combines all 4 exercises to improve circulation, strengthen pelvic muscles, and enhance erectile function. Practice daily for 12 weeks to see results, adjusting for comfort. Warm-up, brisk walking, 3 minutes. Walk at a moderate pace around your home or backyard, swinging arms naturally. Aim for a pace where you can talk but feel slightly breathless. If mobility is limited, march in place, holding a chair for balance. Breathe deeply to oxygenate muscles. Kegel exercises, 3 minutes. Sit in a chair or lie down. Contract PC muscles for 5 seconds. Relax for 5 seconds, doing 10 reps. Focus on isolating the pelvic floor, breathing naturally. Exhale on contraction, inhale on release. If comfortable, add a second set of 10 reps. Seated leg lifts, 2 minutes. Sit in a sturdy chair, back straight. Lift one leg straight out, hold for 3 seconds, lower slowly. Do 10 reps per leg, breathing out on the lift. Hold chair sides if needed. Keep movements controlled to protect joints. Gentle yoga, cat-cow, 2 minutes. On all fours, use a mat or bed. Flow between cat, round back, exhale, and cow, arch back, inhale, for 8-10 breaths. Move slowly, syncing breath with motion. If kneeling is hard, try seated cat-cow, rounding and arching your spine. Perform this routine once daily, ideally in the morning to energize your day, or split into 2 5-minute sessions if fatigue is a concern. Pair with a glass of water and a nutrient-rich snack, for example, walnuts, to support muscle recovery. Tom, the 67-year-old patient, followed this routine, adding beets to his diet, and reported stronger erections and less fatigue within 8 weeks. Track progress in a journal. Note erection quality, stamina, or energy improvements to stay motivated. If you feel pain or no progress after 12 weeks, consult a urologist or physical therapist for personalized adjustments. Beyond erections, how exercise enhances senior life. These exercises do more than improve erectile function, they elevate your overall quality of life. Better circulation reduces cardiovascular disease risk, lowers blood pressure, and improves cholesterol, protecting against heart attacks, a key concern for seniors, as heart health directly impacts ED. Stronger pelvic muscles reduce urinary incontinence, boosting confidence in social settings like family gatherings or travel. A 69-year-old patient, Frank, reported fewer nighttime bathroom trips after 3 months of Kegels and yoga, saying, "I feel freer." Exercise also supports prostate health by enhancing pelvic blood flow, potentially easing benign prostatic hyperplasia (BPH) symptoms. Emotionally, movement counters stress and depression, common ED triggers, fostering a sense of control and connection. John shared, "I didn't just get stronger erections, I feel more alive, more myself." These exercises are a private, empowering way to honor your body, proving that vitality is possible at any age. Addressing common barriers for seniors. Starting an exercise routine can feel daunting for seniors. Here's how to overcome common hurdles. Mobility or joint issues. If arthritis or balance concerns limit walking or yoga, use a chair for leg lifts and Kegels, or try pool walking for low-impact cardio. A physical therapist can modify exercises for safety. Fatigue or low energy. Start with 5-minute sessions and increase as stamina builds. Exercise after a light meal to avoid low blood sugar. Frank split his routine into morning and evening to manage energy. Embarrassment or stigma. Some men feel shy about pelvic exercises. View them as medical tools, like stretching for back pain. Practice privately to build confidence, and join online men's health forums for support. Health conditions. If you have heart disease, recent surgery, or uncontrolled diabetes, consult your doctor before starting. Most conditions allow modified exercise with medical clearance. Addressing these barriers makes the routine accessible and sustainable, empowering you to stick with it long-term. Conclusion: move your body, reclaim your vitality. For men over 60, these 4 exercises, Kegels, brisk walking, seated leg lifts, and gentle yoga offer a natural, science-backed way to boost blood circulation, enhance erectile function, and restore confidence. Avoid overexertion, poor form, and ignoring health issues to maximize benefits and stay safe. This isn't about chasing youth. It's about living fully in your golden years with strength and connection. Start today. Try the 10-minute routine, track your progress, and pair it with healthy habits like a Mediterranean diet and 7-8 hours of sleep. Consult your doctor if ED persists or you have health concerns. You're not alone. Millions of men are rediscovering their vitality through small, intentional steps.